let's say we have an infection fatality rate across the board for this thing in the US, and I'm making this number up a little bit based on, hearing different things. Let's say 0.3 to 0.5. So, and again, I don't know what the exact IFR is. I don't think anyone really knows. But infection fatality rate, meaning if all the people out there are infected and we haven't necessarily tested them, but they've been infected, what's the fatality rate? At 0.3, people will push back and say, why should I take a vaccine that may have a 1 in a million side effect when I'm reasonably healthy? The IFR is quite low. Why should I do that? I mean, how do you think about that?
Well, this virus doesn't just kill you. I mean, flu is more like that, right? Flu, you live or you die. But I mean, this virus causes vasculitis. It causes inflammation of your blood vessels because every organ in your body has a blood supply. Therefore, every organ can be affected. I mean, I have to give a talk tomorrow, actually, with a guy who's with the Army, and there's this Army sort of fitness thing that but he's taking care of a number of young, healthy adult males who have heart disease associated with having been infected with SARS-CoV-2. So the virus can cause strokes, heart attacks, kidney disease, liver disease. These long-termers, the so-called long haulers, they in part may be associated with what is a vasculitic phenomenon. When we had a child who came into our hospital who had pneumonia, a teenager, you looked at that chest X-ray, it looked like lupus. I mean, it looked like a vasculitis. It didn't look like a typical so-called interstitial pneumonia that we normally see. This is a scary virus. I mean, you don't have to die as your only outcome. This can cause longer-term problems. I mean, think about it. When it causes changes in taste and smell, it's because the virus enters the brain. That's why it does that.